Like all medications, ibuprofen can cause side effects. Some common side effects of ibuprofen include upset stomach. Ibuprofen can irritate the stomach lining and cause nausea, vomiting, and stomach pain. Taking ibuprofen with food can help reduce these symptoms. Heartburn. Ibuprofen can cause acid reflux and heartburn, especially when taken in high doses. Headache. Paradoxically, ibuprofen can cause headaches in some people, especially if it is taken too frequently or in high doses. Dizziness. Ibuprofen can cause dizziness and lightheadedness, especially if the person stands up quickly after sitting or lying down. Rash. Some people may develop a rash or hives after taking ibuprofen, indicating an allergic reaction. Fluid retention. Ibuprofen can cause fluid retention, which may worsen conditions such as high blood pressure or heart failure. In addition to these common side effects, ibuprofen can also cause more serious side effects in some people. These include stomach ulcers. Long-term use of ibuprofen can cause stomach ulcers and bleeding, which can be life-threatening in some cases. Kidney damage. Ibuprofen can cause kidney damage, especially in people who already have kidney disease. Liver damage. Rarely, ibuprofen can cause liver damage, particularly in people who take high doses of the medication or who have pre-existing liver disease. Increased risk of heart attack and stroke. Ibuprofen and other NSAIDs can increase the risk of heart attack and stroke, particularly in people who already have heart disease or risk factors for heart disease. It is important to talk to a healthcare provider if you experience any side effects from taking ibuprofen, particularly if they are severe or persistent. Precautions for taking ibuprofen. There are several precautions that should be taken when taking ibuprofen, including avoiding alcohol. Alcohol can increase the risk of stomach bleeding when taken with ibuprofen. Avoiding other NSAIDs. Taking other NSAIDs, such as aspirin or naproxen, with ibuprofen can increase the risk of side effects. Taking ibuprofen with food. Taking ibuprofen with food can help reduce stomach irritation. Avoiding ibuprofen during pregnancy. Ibuprofen should be avoided during pregnancy, especially in the third trimester, as it can harm the developing fetus. Consulting a healthcare provider. It is important to consult a healthcare provider before taking ibuprofen if you have any pre-existing medical conditions, such as kidney or liver disease, or if you are taking other medications. Interactions with other medications. Ibuprofen can interact with other medications, including blood thinners. Ibuprofen can increase the risk of bleeding when taken with blood thinners, such as warfarin. Steroids. Ibuprofen can increase the risk of stomach bleeding when taken with steroids, such as prednisone. ACE inhibitors. Ibuprofen can reduce the effectiveness of ACE inhibitors, which are medications used to treat high blood pressure and heart failure. Lithium. Ibuprofen can increase the levels of lithium in the blood, which can cause side effects such as tremors, confusion, and seizures. It is important to inform a healthcare provider of all medications, vitamins, and supplements that you are taking before starting ibuprofen or any other medication. Conclusion. Ibuprofen is a widely used medication for the relief of pain, fever, and inflammation. It works by inhibiting the production of prostaglandins, which are substances in the body that cause pain and inflammation. While ibuprofen is generally safe and effective, it can cause side